6 new deaths in New South Wales today, so we've got 266 that have been now reported since this wave began in the middle of June. In hospital, we've still got around, well, between 1,200 and 1,250 people admitted to hospital. That's been the consistent picture for a little while now, and that's not growing dramatically at the moment at all. A sign vaccinations are reducing the severity of illness, and also now case numbers dropping should hopefully put some downward pressure on this, at least we hope. 242 people in intensive care, 122 on ventilators. So still a significant number of people who are very seriously ill. We're seeing real improvement in the LGAs of concern in Sydney, Canterbury, Bankstown, Cumberland, Blacktown, Liverpool, Fairfield, Penrith, all of them now showing a reduction in cases day on day, and that's a really positive thing to be seeing. And we have been worried about some areas outside of those LGAs of concern in Sydney, particularly the City of Sydney and the City of Randwick, but both of those too are now showing a bit of improvement in their case numbers, so hopefully that trend continues. Where we're still seeing some problems though is in regional New South Wales, and in particular, these numbers are lower than in Sydney of course, but in particular the Illawarra-Shoalhaven local health district, but also cases in the Central Coast, the Hunter, New England area are trending upwards at the moment. And these, of course, are areas, regional New South Wales on average has lower vaccination coverage than the capital, and that could begin to become a problem as we race toward that 70% double dose mark, when Sydney at least will start to ease restrictions and we'll see people living much more freely, but with lower vaccination rates in the regions, and that could cause some problems. In Victoria, we've got, well, a record day, 766 new cases. It's the highest day of new cases, locally acquired cases Victoria's seen through this entire pandemic, and it's quite an escalation on just the last couple of days. So is this an escalation that we'll see repeated in the coming days? Well, we'll find out in the coming days, but this pattern is not isolated to any particular area in Melbourne, it sounds like. The pattern we've seen of the northern and western suburbs, and in particular the city of Hume, well, the cases are continuing to grow there. Hume has been the epicentre, really, of this outbreak. Now, this doesn't include today's new cases, and we already know that there were at least 200 cases in the city of Hume today, so that 7-day average is continuing to climb in Melbourne's north. Unfortunately, Hume is also a region of Melbourne that is well under the city's average for vaccination coverage. It's also the fastest vaccinating metropolitan part of Australia at the moment, but the gap is big enough that it's taking some time to close that and protect people's health, but also bend this curve through the help of vaccination. So a bit of work still to be done there. And in the ACT, well, another day in the teens. We're seeing these a lot, aren't we? 16 cases in the ACT. Well, that 16 is actually pretty well bang on the 7-day average. It's only about 17 cases a day on average at the moment. The one note of caution here is the number of cases who were not isolated through their infectious period. That's been creeping up for the last few days, and we're kind of now seeing numbers that are really at about the highest they've been through this outbreak on that measure, which could be a bad sign of things to come in the days ahead. But the ACT's been, very lucky to avoid a big escalation so far. We'll hope it continues to be the case as the ACT continues to rocket up its vaccination coverage, continues to protect more and more people from being severely ill and hospitalised with this virus. Let's just hope this line can be held until really the ACT is ready to open up.